Hi folks, this is Saryom for CBNR. In today's video, we are going to see, or I'm going to talk about when to use a diagnostic test, right? The test here, what I mean by diagnostic test is anything from an X-ray, MRI to a slump test or a Lachman's test or whatever we call it as special test. I don't know what the uh, funny name is about, right? So whatever test you're trying to use to come to a conclusion, okay, this is the problem my patient might have, right? That kind of thing, right? So I'm going to talk about how to use it, when to use it, when not to use it, and things like that, right? As I said, it can be any test we are using in physiotherapy or in medicine. Now, I'm going to give some the example of what I have seen in my patient, right? So we encounter a patient, right? So there is a patient who comes to me and he is saying that there is some sensory motor weakness in the uh, in the limb, right? And he also has some pain, but he doesn't have bowel and bladder problems, right? So we also do a lot of other questioning and things like that. But I have just written some of the important things you want to remember, right? Most of the pain is below the knee. Probably the leg pain is bigger than the back pain, and some amount of pins and needles. Probably there is also some sort of pattern, not always, but some pattern is there in the pain as well as in the numbness. Remember, the nervous system is highly noisy. What it means is it cannot be in that particular track or in that particular pattern as we usually think. But either way, this is what we encounter, right? So, what am I thinking, or what are you thinking this patient might be suffering from, right? So, this, what you think that this patient might be suffering from, might be, right, is called as pretest probability, right? This is what we call it as a pretest probability. What that means is before doing any test with some amount of or a good amount of history and things like that, you have come to a conclusion that, or we are assuming that the patient might be suffering from a particular issue, right? Or a particular disease or something like that. That we will call it as a pretest probability, right? Now, even if you don't understand what is pretest probability, that doesn't matter here, right? So what you want to know is, okay, if I see these kind of symptoms, what I will be thinking is, okay, my patient might be probably suffering from sciatica, all right? Now, the question in this video we are going to understand is, okay, from all these things, it seems to be like the patient is having sciatica, but do I need more tests to confirm this? This is the dilemma in, or this is what we do in lots of time in medicine. We want to know, okay, is this enough or do I need more tests to confirm that whether what I have is uh, this information in this is enough from the history and things like that, or do I want to do more tests, right? Right. Most of the time, right? Most of the time, I'm not saying all the time, most of the time, what happens is whether it is some professional, right? Medical professional, most of the time they tend to send you for an MRI, right? Remember, MRI is a very expensive diagnostic technique, and also it's a difficult thing to 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 undergo. So had some health issues. So they told me, my neurologist told me to get an MRI, and they put me in the MRI machine. And before the technician went into the booth, I just ran away and ran out of the room because I was so claustrophobic, right? So MRI is a difficult machine and a difficult diagnosis to, difficult examination to undergo. But we, most of them are sent to for an MRI for further diagnosis, right, or a further examination, whatever it is, right? So what we are assuming is, if with all the other information we had, that is this information, right, these information, if I have additionally this information, that the disc is bulged, this is happening, that is happening, then I may be more sure, right? Remember the word more sure, right? You can never be 100% sure about anything most of the time. So you're more sure that this might be a sciatica, right? So that it's called as a post-test, sorry, the spelling is a mistake here, a post-test probability. That is, if I, after doing the test, what is the probability I get? Say, for example, with this, I am sure 70% I am sure that the patient is suffering from sciatica. So if I get an MRI, now I should be sure, probably 90 or 95% very sure that this is a sciatica, right? That is the idea of doing a particular test, right? Right. So why do we do a test? I just want to tell you certain things so that we can have a better understanding. As I told you, the first thing is we want to be more sure, right? We want to be more sure that what my patient is suffering is definitely what I think my patient is suffering. That is, uh, if I am already with the physical examination and history taking and all those things, okay, what I have found out is been proved by this test, something like that, right? Right. Now, the question you want to ask yourself is, does an MRI give you additional probability, or do they test proves that you are suffering from sciatica? And we all know that that is not possible at all. That is the first point. Why? Because we know that any Tom and Dick, Harry, or Murugan Suppan Kuppan, or with an age, after an age of 35, 40, everybody will have a disc bulge. So whether it is that disc bulge is a true positive or a true negative, or a false positive or a false negative, we don't have a slightest clue. So it is always a problem, right? And there are also a number of problems in the MRI itself, right? But that alone is not an issue here. We also need to remember other things. This is one of the important things I think you should remember. That is it going to change your treatment? Even if you assume that your MRI is a good, or is going to give you a confirmatory diagnosis that this is sciatica. Okay, what treatment are you going to give? Are you going to give some other super duper medicine which will reduce the impingement? Do you have super duper physiotherapy where it will remove the sciatica in 1 day or 10 days? Of course, there are some useless idiots who think that you can do manipulation or cupping or needling or rubbing them or something like that. But we all know that that is not happening, right? It cannot happen, right? So if you are confirming it with MRI, does it make any sense to your treatment? If it does not, what's the value of that test? What is it giving you? Right? It's like, you think of it like this: if you are going with simple fever, right? You don't have body pain, you have slight body pain, you have some cold, and there is a fever which is hovering around 100 and 101 or something like that, and you don't have evening fever or some weird things happening in you. Most of the time they will not You don't need any additional test. You just have to be given a treatment. Why they start a treatment without going additional test is because whatever happens, it's going to be the same NSAD, probably a good amount of rest and lot of fluids. That is all you need, right? So it doesn't matter even if you assume that it's an infection, right? And they are going to give you a saline and antibiotic. It doesn't matter. Only when you think that this is malarial, from all the things they are telling you, right? They have joint pains, body pain, the fever is intermittent, probably in the evening it is more, this kind of thing, then they will go for a malarial test. Why? Because the test will change your treatment. If the malarial test is saying that now malaria, they will change the treatment. Otherwise, it doesn't matter. All right, that is very important. Then the next thing you want to also remember is it also has to change the recovery. If you do this test, I know you're going to do recovery faster, because my treatment, again, this is part of the second point I have mentioned. That is, I'm going to change the treatment because this test is telling me something else is your issue. And these two are, a lot of people are getting into this part more and more. Does the test make more harm, or does it harm you? And we all know that MRI seems to be a big harmful factor, which can make your patient slip into chronic issues, right? Chronic pain also, right? By thinking that, look at this MRI, my back is gone. They are not willing to bend because they have been told that the MRI is, the disc has come out, and all sorts of nonsensical things, right? So you want to know whether the test will cause harm, right? Not the testing itself, but after also, whether it can cause harm also. And also the last thing you want to check out is the cost. And we all know that MRI or an expensive procedure to have for back pain, right? So sometimes it makes me laugh when I think that they spent around 3,000 to 8,000, depending upon where you get the MRI, for low back pain, and spend probably 50 rupees on some painkillers, and probably around 1,000 to 2,000 rupees on physiotherapy, and it is gone. And think about it, the treatment is simpler or cheaper than the diagnostic test, without giving you any additional information, right? So I have this picture of a tire which is, the treads are gone, right? You don't have to go to a tire expert, if you will, to say that this tire is useless, or it is gone, or the threads are gone, right? Likewise, if somebody comes with 60 years old and they have knee pain and they don't have any other red flags and things like that, probably they are suffering from OA, right? Excluding all red flags. Why do you want to take an X-ray and say that, look, your joints have gone, right? Something like this? What is the value in that, right? So these are the factors you want to look into when you are doing any test, right? Don't give this cop out answer of I'm being thorough. No, you're not being thorough. You're making money out of an MRI or X-ray. You're not being thorough. That is not being thorough. Thorough is using your brain, not doing all sorts of tests, right? So uh, so the what is the takeaway point I want to make is, use the test, any test you are using, prudently, whether it is slump test. If you do slump test in 100 people, there will be always 5 people who have whatever it tells is positive, right? That doesn't mean anything. Remember, those are all simple probability. So doing it on every patient, any test will find positive things, right? So don't do test without having a pretest probability or understanding what is a pretest probability, right? Be patient centric. Think about it, whether I will do this if I am the patient. Do I need this testing? Whether the testing will make my treatment better, right? If you think that it makes the treatment better, my decision making better, then please go ahead and do that test, right? Okay. Thank you for watching our video, and please subscribe to our channel. Thank you, and see you again.